Good afternoon, everyone. We're going to just wait about a minute to begin, just to give people enough time to log on. So just appreciate your patience, and we'll be starting in 1 minute. So for those of you just now logging in, we're going to be starting in about 30 seconds, just giving people an opportunity to log in and connect before we begin. Okay, great. I see the numbers going up. So I think we'll go ahead and begin. So first of all, just want to say, introduce myself. I'm Mike Schreiner, your MPP for Guelph, and I want to thank all of you for joining us today. And I want to remind everyone that the session is being recorded and can be shared with participants at a later time, and we'll make it publicly available as well. I want to begin. I'm speaking to you from my dining room here in Guelph. And just to acknowledge that Guelph is located on the ancestral lands of the Haudenosaunee, the Adirondack, and the Anishinaabeg and Ojibwa Chippewa peoples, and is currently the Treaty 3 lands of the Mississaugas of the Credit First Nation. And I think in light of the discovery of many stolen children over the last few weeks in residential schools across the country, I just want to reaffirm my commitment to the truth and reconciliation process. I know there have been many questions about the vaccine rollout in Guelph, questions about what the plan is, about the science of vaccines themselves, and about mixing different vaccines, and questions about vaccine supply. And since so many people have been reaching out to my office, I decided to reach out to Dr. Mercer and Wellington, Dufferin, Guelph Public Health to ask them to do a session today because we thought it would be more efficient to create this type of forum to answer people's questions. We've hosted similar sessions, one in January and one in April, and we've heard from a number of people that those were very beneficial and useful. So we decided to do one again today. And just so you know, today's an exciting day for me. Not only are we hosting this session, but later this afternoon, I will be getting my second jab at the West End Rec Center here in Guelph. And so without further ado, we're honored today. I'm honored to be joined by our special guest speaker, Dr. Nicola Mercer, who is the CEO and Medical Officer of Health for Wellington, Dufferin, Guelph Public Health. Dr. Mercer was appointed as the Medical Officer of Health and CEO for WDG Public Health in 2007. And prior to becoming a public health physician, Dr. Mercer completed her fellowship in anesthesiology and served as the chief of the Department of Anesthesiology at Guelph General Hospital. Dr. Mercer is past president of the Wellington County Medical Association and currently sits as a member of the University of Guelph Board of Trustees. Additionally, she has special graduate faculty status in the Department of Population Medicine at the University of Guelph. And I would just like to say on a personal note how much I deeply appreciate Dr. Mercer's leadership for our community throughout the pandemic. Wellington, Dufferin, Guelph Public Health has led the way on many COVID responses and public health measures, as well as just leading the way in our vaccine rollout within our community. And so, Dr. Mercer, I just want to personally thank you, I think, for your outstanding leadership, your courage, and just the fact that I know when I'm at Queen's Park, so many people comment on the fact of why is the Wellington, Dufferin, Guelph area doing so well in responding to the pandemic and being a leader in vaccine rollout. And a lot of that comes to your leadership. So thank you for that. Thank you for joining us today. And I'm going to turn over the rest of the afternoon to you.
Well, thank you very much, Mike, for your kind words. And certainly it's not a personal effort, but I have hundreds of people behind me in this rollout and public health. And so they have been amazing throughout. So thank you to everyone who's listening today. We're going to have quite a bit of information about this vaccine. So there's many questions that have come in, and I'm hoping that as you go through, and if you're listening and you're able to listen right through to the end, that I'll be able to cover each and all of your individual questions. So just going to start, and let's just get going. So I'm just going to have to move my little person here. Overview of the local vaccine rollout. You want to know what's happened, where we are, where we're going. I'm going to talk about the myths and the facts about this COVID-19 vaccine. And believe me, there are quite a few myths that are out there, and I will do my very best to elucidate the science and provide you with the evidence as we know it to date, as well as answering any of your questions that you may have. Next one. So this is where we are. And if you can look at this, you will see that there are actually three very big peaks. The first peak, which it looks really, really tiny now, doesn't it, occurred back in April and May of 2020. And that was our first peak. And that was our first experience with COVID. And you can see how small it was, but it was a very significant peak because the people who were getting sick during that particular time were a very specific population, and they were our long-term care retirement homes. So the people who were absolutely getting sick and were dying back in those days were our seniors. Then we had a very quiet summer. One of the things we know about COVID is a disease of indoor environments and is going to become a winter seasonal disease for us. So we saw over the summer that our rates went down, and we are seeing again that our rates are lower in the summer as people get outside and as people spend less time in indoor environments where this virus is able to spread. You'll see on the graph two peaks. The big one, that was our first peak right after Christmas, kind of sort of typical right after Christmas. You saw it was starting to climb as we got through November. And part of the reason for that was people moved indoors. And as we looked at the Christmas season, people were getting together. Maybe it was smaller than in previous years. We didn't have the office parties, but people were definitely getting together. And we began to see the spread of COVID, which peaked early in January. And then again, as we went into another lockdown, the disease rates dropped. You'll see, though, that as we entered the beginning, the very beginning of April, our rates began to climb again. You'll see that the third wave that we had locally was even higher than either the previous two waves. And who drove this wave? Well, we saw really it was disease of manufacturing, distribution, the essential workers. We saw a lot of essential workers getting ill in this wave. And that was part of the evidence that was used as we began the vaccine rollout. Next slide. So this is what I'm sure many of you have seen. It's Ontario's COVID-19 roadmap to reopen. So we are in step 2 right now. And so all of the things that are listed on step 2. Interesting thing about step 3 is that some of the numbers haven't yet been filled in, meaning that when we get to step 3, it talks about having larger outdoor gatherings as well as finally allowing indoor gatherings and indoor dining. It doesn't have any numbers associated with that. And that's definitely still in the works as the province looks to see what is the best science and evidence that we can as we open to ensure that we don't have another wave, the fourth wave. If you look at what it says in terms of the vaccination rate, adults 70% with 1 dose, 20% fully vaccinated, you're going to see on the next few slides that we have exceeded that. And in fact, we have exceeded step 3 in the province of Ontario and locally as well. So these are all really good signs because we do not want to go backwards. We want to continue to march through the reopening and get our lives back. Everybody has the same goal here. Next slide. So this is what we see now. So look at if you look at the top, you'll see that it says eligible population age 12 and up. So it's everybody in Wellington and Dufferin and Guelph that can have a vaccine. So right now, 77.5% of people have had at least 1 dose. So that's over almost 2,010 people, 210,000 people, so, which I'm sure we'll be at by the end of today because we are still vaccinating as I'm showing you these slides. And over 41% of people have had 2 doses. So that's really tremendous. So we are making extremely good progress in our local vaccine rollout. Next slide. I love this slide. This is one of my favorite slides. This is where you get to see who's been vaccinated by age group. And you can see that there's a ladder with more people in the older age groups being vaccinated than those in the younger age groups. And that makes fully sense because we actually rolled this vaccine out by risk and by age. So those who were older had a greater risk, as well as some occupations and jobs had greater risk. So this whole vaccination rollout has been very, very much driven by how do we get people to the front of the line who are most at risk? And one of the factors is also age, because age put people most at risk. And so as we go through the vaccine rollout, which is still in full swing, you will see that it's very much laddered. And this graph demonstrates how much that has actually been put into play, that it was rolled out very much on an age-based approach. The light green is those who've had one dose. The dark green are those who've had two doses. And our two-dose vaccine was also rolled out very much by age and risk. So you will see that as the older people are, they're more likely to be fully vaccinated, but those in the middle and the younger age groups are starting to catch up as the vaccine for second doses continues to roll out. Next slide. So I often get asked, how do I get a vaccine from public health? Well, currently, if you have never had a dose, if you have not had your first dose of vaccine, you can show up at any public health clinic, anytime. Just tell them when you get into the line, I'm here for a first dose, I've never had one. They will take you to the front of the line. So this is really important for everybody who's thinking, yeah, I don't want to register, I don't know how to do it, I don't have a computer, I'm not sure, I don't have time. You can just go anytime that you wish to a public health clinic. This is really important for those of you who are going to be our vaccine champions and try and get other people vaccinated. We need everyone to have a first dose. One of the things that we know right now is that Guelph is just the city of Guelph alone. 83.3% of us have had a first dose. Some have had second doses, but 83.3% of us have had at least one dose of this vaccine. We are really close to getting 90% of our population vaccinated. Actually, we've done the math. We just need 8,125 people to sign up for a first dose. That's not a lot. We still have more than that number of people in our population who are eligible and who are able to get a first dose. If you haven't had yours, now's the time. Other places, though, that you can go to get a first dose, you can call your family doctor. Lots of primary care offices in our area are offering vaccine, and you can go to a pharmacy. Many pharmacies, if not almost all pharmacies in our area, have vaccines. Some of them have Moderna, some of them have Pfizer, but they all have an mRNA vaccine, and they're all booking appointments. So that can be a first dose or it could be a second dose. So you have lots of options right now to get your dose of vaccine. Next slide. So are you eligible to book a second dose appointment? Well, actually you are. If you happen to be 12 and up and your first dose of vaccine was more than 28 days ago, then you're eligible. It doesn't matter what you had. You could have had AstraZeneca. You've had AstraZeneca because we know now that most people, because it was given back in mostly in April, most people now are past that 8 weeks after your first dose. So you are eligible to book an appointment. Moderna or Pfizer, you have to be 28 days. If you have trouble with our online registration system, and by the way, just try to do that. Here's a slide to tell you. If you can't do that, you can call us on the phone, book by telephone. In fact, we just, as of this morning, are going to be expanding our hours to 8 to 8. I can give you a clue, though, that if you're trying to call today or tomorrow, we're busiest right after we open. And as the day progresses, we're less busy. So you can book by phone. You can book online. If you got your first dose appointment with us, you probably received an email or text already. If you haven't found it, it might be in your spam or your filter. If you have not heard from us and you had your first dose, or you registered and you haven't even heard about your first dose, please call us. Something has gone wrong with your system. Okay, so you're not forgotten. We need you to put your hand up. We want to get you vaccinated. And sometimes we actually have extra doses at our clinics. And this occurs because sometimes people don't show. Sometimes they've gone and they've got a second dose at a pharmacy, for example, or at their primary care office, and then they forget to cancel their appointment. So most days we have extra doses at our clinics. Obviously, we're trying to get anybody who needs a first dose, we're putting them to the front of the queue, but we often have extra doses as well. We'll put out a call at the end of the day. And remember, of course, that pharmacies and primary care are also giving second doses. So there's lots of places now for you to get a second dose. In fact, I challenge you, please get your second dose in July. There is enough vaccine in Wellington, Dufferin, Guelph in our area that you can get a second dose in July. So please, please, if you have an appointment at the end of August or in September, we don't want you to keep it there. We want you to move up your appointment. We want you to get your vaccine in the month of July. Next slide. Now, some of you might say, I need to be accommodated, and that's perfect. We have a special phone number for you. You see it up here on the screen, extension 4020, or you can email us. If you give us at least 2 days before your scheduled appointment, we will make sure that we accommodate your needs. We strive very hard to ensure that all of our clinics are accessible at all times for individuals. And we have, even throughout this pandemic, if people sometimes don't let us know that they need accommodation, we walk the line, we look through the line, and we try our hardest to find people who do need some special accommodations to pull them out of the line, to make sure that each and every one in our community gets their first and second dose of vaccine in the manner that they need to be healthy and well. Next slide. This is my favorite section. So let's talk about the myths and the facts here. So I've heard a lot of people say that these particular, the mRNA vaccines, this genetic material in these vaccines is going to multiply in your body forever and it's going to change your DNA. Well, that's just not true. In fact, this material that's in the DNA, the messenger RNA, it can't actually interact with your DNA at all. In fact, it is not incorporated in your DNA. It is literally a message. And I know some of you who are listening might be users of Snapchat, for example. The messenger RNA gives a time-limited message to your body to produce these spike proteins that your body then goes on to develop antibodies to. But the message can't last forever. In fact, it doesn't. It only lasts for a very short period of time, just a couple of days at most. And then it just breaks down. It's gone. So if you think that this is going to alter you forever, or your family members, that just isn't the way these vaccines, literally whispering or telling your cells to produce this specific spike protein that allows your body to make antibodies. And it doesn't go on forever. It's just for a little period of time. Next slide. Receiving the COVID-19, will it make you magnetic? Absolutely not. There are no metals, no microchips in this vaccine, and it cannot make you magnetic. And it's important to know, especially, I guess, if you're worried about flying or going through some of those devices that they use at airports, there is no reason at all to be concerned about the COVID-19 containing metals or microchips. Next slide. Can it cause infertility or a miscarriage? Well, there's absolutely been no link between COVID-19 vaccines and infertility or miscarriage. So let me just talk to you a little bit further about what we know about that. So and this actually started by somebody theorizing that this particular vaccine will cause spike proteins to build up in your ovaries. Well, that just isn't the case. It just doesn't do that. These little spike proteins, first of all, that are made are not circulated throughout your body. They don't end up in your organs. They actually bind to the surface of your cells, so your body makes antibodies to them and they can destroy those cells. That is exactly what all vaccines do. Vaccines cause the body to say, hey, you're a foreign substance to me. I'm going to make antibodies. And then those antibodies help the body to recognize what's a bad cell, what's a foe versus a friend, and to destroy the foes. So can it cause infertility or miscarriage? Well, one thing I can tell you is that COVID can absolutely cause miscarriage. What we saw during the pandemic in our ICUs on ventilators, that we had a disproportionate number of pregnant women. We had pregnant women in this province who were ventilated, gave birth, sometimes didn't see their new child for many weeks after the baby was born because they were on a ventilator. And some of those women, unfortunately, that were early on did lose their babies. So having COVID-19 when you're pregnant is a really bad thing. So we don't want that. And what about other ways of looking at fertility? So remember, we have given hundreds of millions of vaccines in North America. We've actually given, far more than that around the world. But if you look at countries such as European countries, North America, the US and Canada, where we track birth rates, if these vaccines, where we have been giving hundreds of millions of vaccines to young adults, in particular young women, if they did cause infertility, we would have seen our birth rate decline. And that's not been the case. In fact, if anything, we've seen a slight uptick in birth rates during the pandemic and since the vaccine rollout. So there is no population level evidence that these vaccines cause infertility. Next slide. If you are pregnant or breastfeeding, you should not receive the vaccine. Well, that is a myth. These vaccines are safe while you are pregnant and or you are breastfeeding. In fact, think about this. We get a lot of diseases when things that you don't know, coughs and colds and viruses when you were pregnant and or when you were breastfeeding. Normal, healthy pregnant women do contract over the course of their pregnancy and breastfeeding other viruses and bacteria all the time. And it is very, very rare that you wouldn't allow a pregnant woman to breastfeed or to be pregnant and not receive the vaccine. I hear this a lot from the flu shot, for example. A lot of people think, oh, I'm pregnant, I shouldn't get my flu shot. Quite the contrary. If you're pregnant, you should have your flu shot. We want to make sure that you don't get the flu while you're pregnant. And that's because as I've said before, being pregnant and getting COVID-19 is really bad for you and your baby. So we want to protect you and we want to protect your baby. So if you are pregnant, please get the vaccine. I can tell you that locally, we have vaccinated at least 1,000 women. I know this because we've seen them at our clinics, and we've been recommending it. Every obstetrician, gynecologist, the Society of Obstetricians, Gynecologists, they recommend that if you are pregnant, please get this vaccine because it's going to protect you and it's going to ensure that you actually have a healthy outcome to your pregnancy. And if you are breastfeeding, well, one thing that's really bad for your mom, for a mom, is if you get COVID, and now how are you going to breastfeed your baby when you were infectious with COVID-19? So if you're thinking about, if you're pregnant, you're worried that I'm just going to not be vaccinated and I'm not going to be vaccinated until after I've weaned the baby, that puts your baby at risk because you may get COVID. And then given that close relationship between mother and child, you may actually pass COVID on to your infant. And we actually have enough documented cases now of babies with COVID, and they end up hospitalized or they don't always do well. So please, if you are considering not getting vaccinated because you're pregnant or breastfeeding, I encourage you to speak to your physician. And again, I can guarantee you that they will encourage you to be vaccinated because they are safe and they are effective while you're pregnant and or breastfeeding. Next slide. People who are vaccinated can shed the virus or spike proteins and infect others with COVID-19. So it's actually, this myth, which is a myth, is actually based on a tiny bit of science. So some vaccines, which we call live virus vaccines, you actually can shed virus. So for example, measles, mumps, rubella is a live virus vaccine. So it is theoretically possible, because we're giving those people who get that vaccine, which we know we all get them as children, it is possible for people with that vaccine to get a little bit of measles, mumps, or rubella and potentially shed the virus. But you can't do that with the COVID vaccine. And it's because COVID-19 is not a live virus vaccine. It is simply a message vaccine. This new technology is really fabulous when we think about it. We don't actually have to give the body any altered or dead or live virus. We don't have to do that, which we've always had to in the past. Now we just have to tell the body a message to make antibodies to the virus, which is really a huge step forward in vaccine technology, and certainly has been one of the reasons why we've been able to get these vaccines out so much more quickly than we would have with old technology. So if you have received the vaccine, you absolutely cannot shed or release any vaccine components to others around you. And we don't, remember, I'm a healthcare worker, as are other healthcare workers. We don't tell our healthcare workers who are vaccinated to take any special precautions other than to protect themselves from COVID when they are vaccinated. So no, this is an absolute myth. This is tied to the last question. So if we developed these vaccines so quickly, we must have cut a few corners in order to do that. Well, the interesting thing about these mRNA vaccines is that we have known about this technology for quite a long time from a science perspective. So it has been lab and science-based development that has been there and has sat there on the shelf needing money to take it to commercialize it. And one thing that the pandemic has done is if you take a world where we have billions of people, many countries, billions of dollars of money out there to say we need a vaccine and we need a vaccine fast. This technology, which was developed many years ago and has been known and has been researched, that finally had the money to actually put these vaccines to development. The other thing that happened too is that normally when we do vaccine development, everything happens what we call sequentially. So you do step one, then you get it approved, then you move to step two, and then you get it approved in step three. And between each of those steps, there is usually many, many months it takes in order for committees to get together and meet and debate their literature. Well, with COVID-19, obviously there was this huge need to have things done as quickly as possible. So what was done is things were done what we call in parallel. So all of our agencies, so ACIP in the States, NACI in Canada, Health Canada, for example, they were actually, as soon as research was out, as soon as studies were under development, as soon as results were available, they had it in real time. So steps weren't done sequentially, they were done at the same time. So as all these studies have been going, and there was no red tape, people needed the answers, and this stuff was fast-tracked, not at the sake of any safety, but just at the expense of red tape as what we could get it through development. Remembering, of course, that the technology was already there. And it really, to me, is a great example of how when you give mankind a tremendous problem, and we all put our human brain power together, a whole world's worth of brain power, how to get a vaccine to development as quickly as we can, you can see what is possible. And that's really just a testament to science that they have been able to create these fantastic vaccines that are so safe and effective as quickly as they have. And I'm positive actually, that this will be the technology that we will use for many years to come, in particular when we deal with highly unusual or lethal vaccines, such as, for example, Ebola. Next slide. COVID-19 vaccine is not safe for children. Well, currently we have vaccines that are approved for ages 12 and over. So Pfizer is approved. Moderna has had their application in front of Health Canada now for a few weeks. So I'm expecting at any point that we will hear that the COVID-19 Moderna vaccine is approved for children 12 and older. So let's talk about this question. Let's talk about it from 11 years of age and under. Is it safe or not safe for children? Well, what I can tell you is that there are a number of big trials underway looking at vaccine in children, so the COVID-19 vaccine. So I am anticipating that in September of this year, that the results of these trials will be sent to, whether it's in the US, the CDC, or their equivalent, and in Canada, it will go to Health Canada for approval. Based on the science of these studies, and by the way, the children are developing fantastic immune responses to these vaccines, and everything that I've seen in the literature about these studies is that they are safe and 100% effective for children, which is not surprising. We know these vaccines are very effective in adults over the age of 18, numbers like 95%, which we don't normally see in vaccines, especially for elderly people. We normally see that vaccines work really well in younger people and generally not as well in older people when our immune systems are not as good. So when we vaccinate people in their 80s, for example, we know that the flu vaccine just doesn't work as well in that age group. But these vaccines are so good in older people, it's not surprising that young people and our children develop very robust immune responses to these vaccines. So do I think it's safe for children? I do think it's going to be authorized for use in children, absolutely. Next slide. So answering your COVID-19 vaccine question. So let's see what some of the questions were. Can I get just one dose of vaccine? Not in Canada, and I say that's right, hair on my face. Can you get one dose? No. And the reason being is we don't actually have a vaccine approved in Canada that's good for just one dose. You need to have 2 doses of vaccine. And this is particularly known with the Delta variant. So prior to the Delta variant showing up in Canada, we looked at that. One dose of vaccine was really good, not as good as 2 doses, but really good. But with the Delta variant, we know that it takes 2 doses of the vaccines that are currently available, Moderna or Pfizer, to protect you from the Delta variant. And so for those of you who thought, I've had one, I don't really want to get 2, please get the second dose. It will not only protect you from the Delta variant, but a second dose of vaccine often gives you what I call the longevity boost. So it's making sure that this vaccine doesn't just last for a few months, but we're actually quite hopeful that these vaccines are going to last for years. And so that's what the latest science is showing us. And so that's really good news, but you need to get 2 doses. Can I choose which COVID-19 vaccine I get? Well, right now on the market, we have 2 vaccines. We have Pfizer and we have Moderna, and they are biosimilar. And by that, I mean that they both give our cells the exact same message. The delivery, the sort of the envelope that surrounds this message is slightly different for the 2 vaccines, but they are essentially the same. So if you wish to choose your vaccine, we're not actually, as I can tell you that when you go to one of our clinics, if we have the vaccine that you were vaccinated with the first time around, we will match it for you. If we don't have it, and we often don't, then we will give you the other one. And that is because they have been approved, either one, because they give the same message, has been approved to be interchanged in Canada. So for those of you who wish to choose at a public health clinic, we do our best, but we certainly cannot guarantee this. If you have your vaccine at a pharmacy, though, what I can tell you is pharmacies tend to have this, they only have one vaccine. So if you got your vaccine at a certain pharmacy and you go back to the same pharmacy for your second dose, you will get the same vaccine because they are only being provided with one vaccine. Public health clinics, we're the big ones. We're vaccinating more people proportionally than pharmacies. We have to rely on whatever vaccines we get from the province, and there has been a little bit of variability. Some weeks we have more of one and less of the other, but I can tell you that they are biosimilar, and so they work the same way. I do know that Pfizer has been the more sexy one of the 2 to get. People like the sound of the name Pfizer. Sounds better than Moderna. And so there have been some trials looking at that, but these 2 vaccines work the same and are essentially the same. So please get the vaccine which is offered to you. It is more important with this Delta variant circulating that you get the second dose of a vaccine or get the first dose of a vaccine rather than trying to shop around and get the one that you want in this case. They're both safe and effective. Can I mix vaccine types and still be considered fully vaccinated? Yes, absolutely. In fact, we've been doing that across Ontario now for tens of thousands of people. So here's a lovely little chart to show that you may have had as a dose 1, you may have had any one of 3 different vaccines, AZ, Moderna, Pfizer, and you may, when you have been a person who's had a second dose of AZ, you may have then followed up, for example, AZ, you may have had either Moderna or Pfizer or any number of these combinations. Ultimately, though, 2 weeks after you've had your second dose of your vaccine, then you are considered fully vaccinated. And you will receive a certificate in your email that indicates that you are fully vaccinated. Are vaccines effective against the variants, and what percentage of cases in WG are currently the Delta variant? So I'll start with the second part of this question. So the interesting thing about the Delta variant, it is anytime we do what we call whole genomic sequencing, it does take weeks to do that, to know exactly what we're dealing with. So we look for markers of the cases as opposed to doing the genomic sequencing, which is very retrospective. So in Ontario right now, depending on the area you're at, it could be anywhere from 15 to 50% of the samples are the Delta variant. Locally, we've been certainly on the higher end in the province. I would estimate that we are at least 30% of the Delta variant and more likely closer to the provincial average, which is about 50%. It is everyone's expectation, though, that by the time we get to the end of July, that the Delta variant will be approaching, for most parts of Ontario, approaching 90% of all the cases that we see. So are these vaccines effective against the variant? So the answer is they are if you've had 2 doses. Now I hear a lot of people say, oh, these vaccines don't work. I heard somebody got COVID after they had 1 dose or after they had 2 doses. And yes, that may be true. No vaccine is 100% effective. But what I can tell you is the people who I know, and because I know of all the cases, I know of who's had the COVID-19, if they've had a vaccine, what I can tell you is people who are fully vaccinated, and if they are rare and unluckily get COVID-19, often they don't even know it. They have either no symptoms or minimal symptoms. And that is because these vaccines work. They are safe, they are effective, and they protect you from getting severe disease, from being hospitalized and dying. So the vaccines are very effective against preventing those really bad outcomes from the variants. And for most people, they will prevent you from actually getting a case of disease. What should I do if I got my first dose outside of Ontario and I need to get my second dose? Well, the answer to this question depends on what did you get while you're outside of Ontario. So what country did you get your first dose in? So there is a process in place right now. So if you got your first dose somewhere else, and it is a Health Canada approved vaccine, then we can log that into COVAX, which is our registration system, and we can get you your second dose if it's a Health Canada approved vaccine. If you got something that's what we call a World Health Organization approved vaccine, so in this case it might be Sinopharm, for example, one of the Chinese doses. If you got that as your first dose outside of Ontario, we don't offer that as a second dose in Canada, and so you will need to restart your series and get 2 doses of a Health Canada approved vaccine. If you got your first dose of a non-World Health approved vaccine, there are a few out there, then again the answer is you will need to restart the series and have 2 doses of a Health Canada approved vaccine. So these things are all known, and we know people come and go and travel, whether people are emigrating to Canada or whether they're students coming for work terms. So these are, we know the options, and so the most important thing is to call public health, and we'll figure out what it is that you need to be fully vaccinated. How do we know the vaccine is safe for children and youth 12 to 17? Well, we know this based on trials, large trials. And around the world, there have been not just thousands, not just tens of thousands, but there have been hundreds of thousands of vaccines that have been given. And they have been given in children with 12 to 17. And so we have large amounts of safety data. And these countries are countries that actually aggressively collect what we call adverse events following vaccines. So in Canada, as in Europe and UK and in the US, anything that happens following a new vaccine is called an adverse event following immunization. That's all collected. Most of that is not as a result of a vaccine. So for example, 4 days after somebody has a vaccine, they faint. Well, we record that and we look to see, is there an incidence of people fainting 4 days after they receive their vaccine? We collect that. Most of the time, what we see, for example, is not out of normal and could be related entirely to something else. The individual had another health issue going on. But it is important that all of the safety information is collected systematically on all of the vaccines that we have in order to ensure that we don't miss anything. That's how VIT was found, for example, with AstraZeneca. It is really important that we look carefully, broadly, compare it to what would known to happen in the population, and to see if, for example, there is any safety signal. Is there anything that's occurring slightly more common now that we've introduced the vaccine into the population? So based on that, I believe, as does NACI and Health Canada and other countries and other experts, that these vaccines are safe for children in youth 12 to 17 years of age. So I've heard that COVID-19 isn't as severe in children. So why are we vaccinating them? Is it worth the risk? Well, let's look at it this way. So, COVID-19, is it severe in children? It's not as severe, but it can be as severe. So, what I can tell you is that I absolutely have seen um, really bad cases of COVID-19 in children. We have had children in Canada die of COVID-19. So, on average, in general, most children have a less severe course. But children can still have bad outcomes for COVID-19, and children can still be hospitalized with COVID-19, and they can still actually have sort of the long COVID symptoms or the long haul symptoms that some of you are hearing about. So, this is not a benign disease, and we actually still don't know what is going to happen to people who have a case of COVID-19 a year, 5 years, or 10 years after COVID-19. So I think that if you know, obviously for my children who are actually young adults now, I have them vaccinated. They're vaccinated. If my children were in the 12 to 17-year-old age group, I would have still vaccinated them because I do think it's worth the risk. I think that this is not a benign virus, and it can harm or kill children. And so I don't believe that it was worth the risk to not vaccinate them based on everything that I know about COVID-19. When will the vaccine be available for children under 12? Well, I don't know for sure. I know that it will likely be going for approval in about September. My guess is that it will be sometime mid to early to late fall. So somewhere between Thanksgiving, Canadian Thanksgiving, and the end of November would be my guesstimate as to when we will see Health Canada approval for children. And likely the first group of children approved will be, for example, 5 to 11-year-olds. It won't be everybody under the age of 12, but it will probably be a portion or a sub-portion of that population under 12 will be approved first. Will eligibility with the Moderna vaccine be expanded to youth? Yes, and actually, I thought we were going to hear about this last week, so I'm sort of surprised, but I'm anticipating that we will hear very, very shortly that the Moderna vaccine is going to be expanded to youth, and so that is the expectation, and so we're just sort of waiting on that information. My child is turning 12 later this year, but the system won't let me register them. When can I register them? You can register them on the day your child turns 12. That is, unless the vaccine is approved for those under the age of 12 sooner than that. But for example, if your child turns 12 in December, very likely the vaccine will be approved for children under the age of 12 prior to that. Otherwise, you do have to wait until they turn 12. This is sort of a safety system so that so we don't inadvertently vaccinate children under the age of 12. Are you concerned about reports of myocarditis that are related to the mRNA vaccine? This is a great question. So it's actually not just myocarditis, but it's myocarditis/pericarditis, which is a inflammation of either the heart muscle or the lining surrounding the heart. So what we do know, and this is based on, as I spoke about earlier, really gathering all of the information, any side effect of any type that occurs in the 30 days after somebody has a vaccine. What we do is we collect all that data and then we go back and look at it. And based on that, countries such as Israel and the UK and the USA, which are slightly ahead of Canada in their vaccine program because they had the vaccine earlier, they thought, and I'm just going to say this really carefully, they believe that there is a slight safety signal with these vaccines and myocarditis, pericarditis. And I use that language very carefully because it is a very small increase. And because the increase is quite small, it is very difficult. They think it's real, they were puzzling over it. And I do believe that it is real, that there is a very slight safety signal for myocarditis, pericarditis. Okay, so now I'm sure all the parents that are listening are going, oh, I'm not getting my kids vaccinated. Let me just explain what this means. So this very slight safety signal, so it's rare. We look at, they think it's estimated about 60 cases in a million. It's a very rare event. And when they sort of dived into that rare event, what they learned was that for all of these myocarditis, pericarditis children and young adults, mostly young adults that get this, what they saw was that almost 90% of these people were treated over the counter at home. So they were treated with things like Advil, sort of anti-inflammatories. They did very well. And for the remainder, those individuals who were admitted to hospital, they also did well. And there has been no deaths reported to date of this particular side effect. So we're not talking bit. We're not talking something that's really, really scary, bad, has really serious effects and can kill you. We're talking about something that we are absolutely watching. Every physician in Canada has been warned we have to keep an eye on this. We have not in Canada seen a safety signal yet. Most likely that's to do with the fact that this particular side effect seems to be more common with the second dose, and we haven't given lots of second doses to younger adults yet. I'm not saying that Canada is not going to see it, but what I can tell you is we haven't seen the safety signal to date in Canada. So meaning that safety signal means that if you see something that's always in the population, you have to see something that's slightly above the rate that you would normally see in the population, because we see myocarditis, pericarditis in young adults, on children in the population without the vaccine being present. So we have to see something that's just a little bit above what we would normally expect to occur. So it is likely real, but I'm still telling you that I strongly advise you to vaccinate your children and your young adults. And why do I do that? Because if you take a population and you say, okay, let's not vaccinate them, what will happen to these young adults and these children if we don't vaccinate them? Well, we know quite a few of them are going to get COVID. And we know of those children and young adults who do get COVID, some of them are going to end up hospitalized. Actually, much larger numbers are going to be hospitalized than if the population was vaccinated. And we know that 2 of those people who are hospitalized are going to die. So what we can see is we compare apples to apples as best we can, a similar population, both of them trying to vaccinate one or not vaccinate the other. This COVID-19 is serious. And I take this very seriously. And I did not discourage my own children from having an mRNA vaccine, both doses, because I do believe that the consequences of having Delta variant are much more significant and are much potentially worse than the very small treatable risk of having the mRNA vaccine of myocarditis, pericarditis. So I hope that answers your questions. I'm trying to do so in a way that sort of says both sides of the question. And if you have any further concerns on this particular topic, I encourage you to speak to your primary care provider for more information. You're going to be able to be required to be vaccinated to go to work or school. Will there be a COVID vaccine passport or certificate I will need? Well, I think if you're choosing to not be vaccinated, that it is going to be limiting for you. And I say that because it is quite likely that you will be required, for example, to show a certificate or a COVID passport, whatever you want to use the word, if you have to cross the border. So if you want to go to the US for shopping at American Thanksgiving, potentially you will have to show a COVID passport screening. We know that this is currently in effect even within some Canadian provinces in terms of the movement within Canada. So that is a possibility if you choose to not be vaccinated. Will we be able to go to work or school? Well, some occupations and potentially some private businesses may wish to have their population vaccinated, fully vaccinated, in order to ensure that they don't have outbreaks in their plants or in their workplaces. Certainly, we know that long-term care homes, for example, that is highly recommended, and that and that they have these new processes in place for individuals who work in certain occupations to be strongly encouraged to seek COVID vaccination. There are actually very, very few medical reasons to not be vaccinated with COVID-19. There's only a few allergies that are possible within the requirements within the vaccine. So there really are not a lot of medical reasons to not be vaccinated. So if you are philosophically opposed to vaccination, I would encourage you to to learn more about these vaccines. I think that it is quite possible that it will limit some of the things that are going to be required. We know that there's going to be, in the very near future, there'll be sort of guidelines released in terms of fully vaccinated people can get together with other fully vaccinated people in certain environments. And you're choosing to not be vaccinated, you're putting yourself and those around you, in particular if they're not fully vaccinated, at risk of COVID-19. And that is very worrying in terms of your health outcomes. And even for those of you who think, I'm not worried about COVID, I'll get it and I'll recover. Well, you probably will recover, but what we do know is that long COVID is definitely a thing. And we do see a certain percentage of people who weeks to months after they've had COVID-19 and have recovered from it, they have significant symptoms, in particular fatigue symptoms and other difficult to describe symptoms that sort of are persistent. And many of these people, I'm sure if you ask them, would have said they would have preferred to have been vaccinated than have these sort of ongoing symptoms that sometimes prevent them from working. So please, if you're still on the fence, please talk to your healthcare provider about vaccination. So if I've had 2 doses, I'm saying fully vaccinated, do I still need to wear a mask and physically distance? For a little while, yes, the answer is. So we are still not fully vaccinated as a population, so it's over 40% now. I'm guessing that by the end of this week, it will be about 50% in Guelph. But what I am going to say is that eventually, no, if you are fully vaccinated, there will come a time that we will be able to not wear masks and not require physical distancing. And that will be a stepwise approach determined by our Chief Medical Officer of Health, but that will occur for those who are fully vaccinated as we slowly come out of this pandemic. But for the next number of weeks, yes, there will still be a requirement to be masked and be physically distant as we try and catch everybody up to the vaccine. This is an interesting question. So what percentage of the population needs to be vaccinated to stop the COVID-19 pandemic from spreading? Well, it's kind of a moving target. So and I say that because as this virus becomes more transmissible, we need to have more people vaccinated to prevent it spreading. By that I mean, for example, when the Alpha variant, which some people might know as the UK variant, it's now called the Alpha variant, was first identified, it was more transmissible than the wild type or the original COVID. So it was estimated that we need about 75% of the population vaccinated in order to prevent this virus moving person to person. So it's a virus of people. So if I have COVID-19, and I can't, my body, as I'm moving around in my circle, if everybody that I come into contact with is fully vaccinated, this virus can't find another host. It's looking for somebody who's under vaccinated, either 1 dose or no doses, in order to move from person to person. So that's what it means when we're talking about to prevent the virus from spreading. But as the virus becomes more transmissible, which means it seems to go much easier to those people who aren't vaccinated or are only partially vaccinated. You need to have a higher number of people around them vaccinated. It is now estimated, and again, these are just estimates, that with the Delta variant, that we need a higher rate of herd immunity, a percentage of people vaccinated to prevent this particular strain from spreading. Approximately, certainly more than 80%, it could be 85%. I don't know that exact number. I think it's still being worked out, but it is more than what we estimated with just the Alpha variant. So in the city of Guelph, we're getting close to 85%, 83.3%. And so if you are in Guelph and you haven't had an opportunity, go to a clinic. I guarantee you that we'll get you your vaccine today, whatever day you show up. And it helps boost our numbers. We can get to 85% because we all want this pandemic to be over. And remember, for every one of you who is listening right now, you are the most important part of this vaccine effort. And so for each and every one of us, we can do our part, we can be vaccinated, and you can bring along those that you know that haven't been vaccinated. So we all have friends or family or people that we can talk to, help them if they need a ride, if they, they need to have help with online registration, we can help somebody to be vaccinated. And at the end of the day, the most important member of this vaccine effort is you. So we can get this done. Thanks, everyone.
So thank you, Dr. Mercer. That was a lot of questions to answer. So I appreciate you taking the time to answer them. And I want to thank everyone who joined us today, who sent us questions when you registered. And just to remind people that you can have paid time off to be vaccinated. And so if that's an issue for you, certainly take advantage of that. If you have any additional questions, you can always visit the WDG Public Health website. There's a great FAQ with lots of answers to questions there. People can always reach out to my office if you need questions answered and or you're looking for additional supports. Particularly, I know a number of small businesses in our community have been really struggling, and we've been doing the best we can to provide you with the supports that are available. And once again, thank you all for taking the time to join us today. I'll be receiving my second vaccine later this afternoon. And Dr. Mercer, I know you're incredibly busy, so I really, really sincerely appreciate you taking the time to answer questions and provide us with some really important information about COVID and the vaccine rollout. So thanks, everyone. Bye, be safe, be well, and have a good day. Bye for now.